Okay. Hi, I'm Dr. Carly Patterson. I am a veterinarian boarded in small animal internal medicine, and I'm a clinical assistant professor in the Department of Veterinary Physiology and Pharmacology here at Texas A&M in the College of Veterinary Medicine and Biomedical Sciences. In terms of how I got to Texas A&M, that's a little bit of an interesting story. I always knew that I wanted to be a veterinarian from a very young age. I thought I wanted to be a zookeeper, but my dad told me that perhaps I should think about becoming a veterinarian instead. And so I, worked really hard through high school and undergrad and got into veterinary school at the University of Illinois, which is where I'm originally from in terms of Chicago, which I'm sure you can tell from my accent. And when I originally got into veterinary school, I thought for sure that I was going to be a small animal practitioner working with just dogs and cats, and that I would really like doing surgery, and that was going to be great. And I got to my surgery courses as a vet student and realized I really did not enjoy surgery as far as how nervous it made me, and it was really technical, and it was just really not something that I wanted to do long term. So I started thinking throughout my fourth year, as far as all of my different clinical rotations, about specializing in a particular field, and I really enjoyed internal medicine for small animals. Because it's a lot like solving a puzzle or a mystery, really. And so you have to put all the pieces together, and you don't always find the answer that you want, or sometimes you don't even find an answer, but it involves putting a lot of different pieces together and doing a lot of detective work. So that's what really drew my interest about internal medicine. So I got a small animal internship at Texas A&M, and so I came down here after I graduated from veterinary school, and I really liked all the people, all the faculty and the students, and just the atmosphere down here. So I applied for the residency program in small animal internal medicine, and I was fortunate enough to stay on as a resident for another 3 years, and just worked with a lot of different dog and cat cases in the small animal hospital, working with a lot of different vet students, with a lot of different professors, with a lot of different other residents and other specialties. So I learned a ton while I was here. And then when I was finishing my residency, it was the same thing. I thought I was going to go into private practice and do, the same sort of work that a lot of my friends had done when they finished their residencies. And I realized again that I wasn't necessarily going to be happy just seeing a lot of cases day in and day out and not having that chance to interact with the students and other colleagues like faculty members or residents in other specialties, because that's what I really enjoyed in the teaching hospital. So I took a little bit of time off to kind of figure out what I wanted to do, and then realized that there was a position open here at Texas A&M in a different department to teach pharmacology to the vet students. And I realized being an internal medicine specialist, we deal with a lot of drugs on a daily basis, and I really enjoyed pharmacology. And so I thought it was a really unique way to kind of use my clinical experience and the interactions that I really, really enjoyed in the teaching hospital and put them all together. So I interviewed for the position and started on faculty in May of 2016. So I've been here just over a year in this particular department, but I've been at Texas A&M for about 5 years now. So that would be my biggest piece of career advice, just going through my story and how I ended up here, is just to keep all of your options open and not think that because you grew up loving horses that you can only work with horses, or because you've only worked with dogs and cats that that's the only thing you can do. I would just say, keep your options open and listen to other people as far as what makes them tick and what makes them happy. And when you kind of put those two things together, it helps you figure out your own path. So, and don't let anybody tell you that you can't do something. I think that's my biggest pet peeve, is when I hear people from all different career paths say that you can't do something because no one's ever done it before, or people don't do it that way. So that would be my other advice, is just to ignore that sentiment and focus on what really makes you happy and figure out the way to get there. And it's not always easy, but you often learn a lot in the process. So I definitely have, because again, I did not think that I would be in a faculty role in any sense of the word, but I really love my job and I wouldn't have it any other way. So that is my story. And in terms of telling people, what goes on with veterinary medicine that maybe a lot of people don't realize, I think is just to understand that our biggest role is providing that communication link between everything that we know and what you see in your pet, your beloved animal, and trying to make all of those pieces of the puzzle align. So I think communication is a really big part of our overall field, and maybe most people don't necessarily realize that we really work on that aspect of things and try to impart our wisdom in a way that everybody can understand. And so that's another thing that I'm really passionate about, is developing lines of communication and educating my clients, because again, they've meant so much to me. And I think having those lines of communication open is a really important thing, and something that we don't necessarily always think about first and foremost, because we want to figure out what's wrong. So just keeping that in mind and realizing that your veterinarian really does want to make sure that everybody's on the same page as far as developing the best plan for your pet.